Hello, all. Helping Hands for ECHS is very happy to bring another video number 110. I'm Commander Santanam. This is a volunteer effort. This video is about organ transplant surgery, namely kidney, liver, lung, or heart transplant surgery, and how beneficiaries can get prior approval in order to get reimbursement. This video will also cover the ECHS package rate for these items. A brief introduction. Kidney, liver, lung, or heart transplant surgery are normally a planned procedure. That means it is normally not an emergency condition in which these surgeries are undertaken. However, if there is an emergency medical condition, there is certain amount of relaxation in the policy is available for obtaining reimbursement after the surgery. I will cover that in little more details in the later slides. ECHS guidelines and ceiling rates, which is called as package rates, for each of the above surgery are available in order that you can get reimbursement up to the amount which has been approved. Another important point is, as per the Government of India policy and ECHS policy, organ transplant surgery is allowed only in government hospitals or in private hospitals who are registered under Transplantation of Human Organ Act 1994. This is called a TOA 1994 Act. I mean, they have to be registered. In order to perform organ transplant surgery, they must have this certificate. This has been amended in 2011 as well. This video will explain steps for obtaining pre-reimbursement approval and what is the ECHS package rate. Now, liver transplant covers acute liver failure, chronic liver disease, and liver tumor. Now, in the case of transplant surgery, there are two types of donors. One is a deceased donor whose liver is taken and provided to the, let us say, ECHS beneficiary, or it could be a live donor, a relative or somebody who's alive whose liver is part of it is taken and then it is transplanted to the beneficiary who is the patient. I will now cover for planned liver, lung, and heart transplant what are the reimbursement steps. They are more or less the same, hence I have covered it in one slide itself. As I mentioned in my opening statement, prior approval from the Standing Committee of ECHS central organization must be obtained by the beneficiary before the surgery under a planned condition. That is, this is not an emergency. So there is an approval process which has to be gone through. In order to get the approval from the standing committee, a beneficiary who is affected must make an application, personal application, attach necessary documents, which are medical documents, and then they are to be submitted to your OSC polyclinic. Medical documents is the need for a surgery and reports, etc., etc. OSC polyclinic will verify the application for its correctness and completeness, and they will forward it to the regional center. And the regional center will normally send this to the central organization by an email. Typically, when the standing committee, you know, examines your application, typically within 15 days you will get an approval for this undergoing the transplant surgery in order to get the reimbursement as per the approved amount. So this is an important prerequisite for planned surgery of all of them. That is liver, lung, heart. In your application, you have to attach documents, which is personal application, medical case sheet, and relevant reports with a recommendation for organ transplant, clearly, cost estimate for the surgery from the hospital where you would like to take this particular treatment or the surgery will happen. The hospital will provide you detailed cost estimate. Hospital will also provide you with a registration certificate under TOA Act 1994. I mentioned it. That hospital must be registered for this. Then only they can do this organ transplant surgery. Then only your approval process will go through. This is a very important document. Copy of ECHS card and Aadhaar card, and any other relevant document which you have in order to prove, in order to give the correct picture as to why this particular organ transplant is required, etc., etc. Because this will be examined in detail by the standing committee of ECHS at central organization. One of the members is also a doctor, fully qualified doctor for transplant surgery. So you have to give as much detail as possible to your OSC. It will go to the central organization. On about within 15 days or so, you will get the approval formally by a letter from the central organization. Now let us see what is this package rates for all these very critical surgery. For liver transplant, if the liver is from a live donor, the maximum amount which is payable, which will be approved, naturally you will get this money if it is approved, is 11 lakh and 50,000 rupees. That is for the surgery. Prior to the transplant surgery, there is a donor and a recipient. Now, evaluation of the donor and recipient by that hospital from where you got the estimate, you are allowed to be given 2 lakh 50,000 for both donor and recipient. This is a live donor. In case it is transplant surgery, the liver is given from a deceased liver donor, then the total cost which will be reimbursed is 11 lakh. So there are two cases in the case of liver. What this cost covers is maximum 30 days hospital stay of the recipient, the one who is getting the liver, 15 days stay for the donor who will also be admitted, and all procedures, surgical procedures, investigations, consultation within the hospital, operation theatre charges, anesthesia, medicines, everything during the stay of the in the hospital. Okay, this is under a planned condition where you are getting all the documents, sending it to the central organization, you are getting the approval, and then you are getting admitted, and the surgery goes through very well. In case there is an emergency, there is ex post facto sanction or approval by standing committee is possible. Ex post facto is after the surgery, which has happened because of an emergency, the beneficiary or next of kin can still approve in the same manner with all the documentation and send it through the OSC for ex post facto sanction. So this facility is also available as per the ECHS policy. In the case of lung transplant surgery and heart transplant, and both lung and heart transplant surgery, the maximum package rate which is allowed, which will be approved depending on your application and the documents, maximum amount is 25 lakhs. This is reimbursable. For heart transplant, it is 15 lakh, and a combination of both is 35 lakh. Once again, any one of these surgery in an emergency, ex post facto approval by the standing committee is possible up to this amount. So lung is transplant is 25, heart transplant 15, combined both lung and heart 35 lakh of rupees. This is the amount which is maximum reimbursable for a beneficiary. Supposing this liver, lung, or heart transplant surgery is carried out in an ECHS empaneled hospital, you will still get the estimate from the hospital, and you will submit the standing committee approval documentation, and then when the approval comes, you will take a referral from the polyclinic along with the referral and the standing committee approval document. You will submit that in the empanel hospital so that they will be able to complete the surgery, and they will get the money up to this amount directly from the ECHS because you got the approval already. Okay, whatever amount I have explained in the previous slide for both liver and the other lung and heart transplant. Supposing you want to get it done in a government hospital, it may be a non-empaneled hospital. Any government hospital which is empaneled will be driven by this particular policy. If it is a government hospital and it is non-empaneled, then you will get the standing committee approval. There is no referral requirements. However, you can get an advance up to 80% of the approved cost. Okay, you will have to clear the bills. You will have to pay whatever is a government hospital is charging, and then apply for the reimbursement in full. Or if you take an advance of 80%, you have to apply for reimbursement of balance 20%, and also the contingent bill will talk about the 80% advance which you have received. This is only available in government hospital. Supposing a beneficiary as wants to get it done in a non-empaneled hospital planned, then the bills have to be settled and then apply for reimbursement to the approved cost. So there are three cases I have discussed here: empaneled hospital, government hospital non-empaneled, and non-empaneled private hospital. Okay. This is for liver, lung, and heart transplant. In the case of kidney transplant, there is no requirement for standing committee approval. The reason is the entire kidney transplant surgery is in the ECHS package rate called as a listed procedure. That means already the rate is already fixed and it is available as a policy to the hospitals, and you will be able to get when you get admitted in a empanel hospital for a kidney transplant. ECHS rate will apply by the empanel hospital for cashless treatment. If it is any other hospital, then we go through this process. I hope it's clear. These liver, lung, and heart in empanel hospital, government hospital, and non-empanel kidney transplant, you can directly go to a ECHS empanel hospital, listed procedure. The rates are already fixed. Okay, and they will do that, and cashless, you will be able to get the transplant done and get discharged. There are few letters which are of importance, which addresses whatever I have stated so far in this presentation. COECHS letter 2nd September. These three letters addresses liver, lung, and heart. For kidney transplant, there is a separate letter of 20th February 2015, which basically gives you the package rate for kidney transplant. And the last one is Helping Hands for ECHS YouTube channel. Some videos addresses this particular treatment in non-empanel hospital, government hospital, organ transplant in government hospital. Video number 46 is a very specific video which you can watch addressing government hospital, that is transplant surgery undertaken by a government hospital. This addresses the entire procedures as well. So these letters are available as a policy, which is what I have covered in this short video. As I always been saying in the 109 videos, this is a volunteer effort. I've taken a lot of effort to put this presentation together and the video together. Kindly do not copy or reproduce without my permission. However, share my videos to your friends, to any veterans and families, so every one of the veterans and families or ECHS beneficiaries gets to know what is our facilities available. They get empowered to get the best out of ECHS. I thank you and appreciate your support. Helping Hands for ECHS, as I mentioned, is a volunteer effort. Two facilities is available to everyone, every beneficiary, anywhere in India or abroad. One is my web portal. This is the link. Other one is my YouTube channel link. So all the 110 videos are available in this YouTube. They are also linked in the web portal. In case you need help, 100% of queries are answered today by this. In case you still need help, you can message me to my WhatsApp. If there is an emergency and there is nobody else whom you can contact, you are most welcome to call my mobile. I will try my best to help you to the best possible way. Jai Hind.